For more anatomy-related videos, please subscribe to my channel, Learn with Dr. Tanya Hashik.
Hello everyone, in this video we'll discuss about the oral cavity. So from today onwards we'll discuss about the anatomy of the digestive system. So first we'll discuss about the oral cavity. So oral cavity, it can be divided into two portions. That is, an outer smaller portion is called as the vestibule and the inner larger portion is called as the oral cavity proper. So today we'll discuss about the anatomy of the vestibule as well as the anatomy of the lips. In this figure I have drawn the picture of an open mouth. So this is the lips and this is the tongue, and the space between the teeth and the lips is called as the vestibule. So this space between the teeth and the lips is called as the vestibule. So externally it is bounded by the lips as well as the cheeks, and internally by the gums and also the teeth. The vestibule, it communicates to the exterior by oral fissure. That is, the opening of the mouth is called as the oral fissure. So with the exterior it communicates by means of the oral fissure, and with the oral cavity proper it communicates when the mouth is open, and when the mouth is closed also it communicates with the oral cavity proper through the space between the third molar. That is, behind the third molar there is a space through which the vestibule, it communicates with the oral cavity proper. So numerous structures opens into the vestibule. That is the parotid duct. That is parotid duct which is located in the inner surface of the teeth opposite to the second molar. It opens into the vestibule. The parotid duct which is present in the inner surface of the cheek opposite to the second molar, it opens to the vestibule. And in the same manner, numerous buccal as well as labial glands which are present within the lips and also cheeks, it opens into the vestibule. So what all are the structures? The parotid ducts, the labial and buccal glands, etc. opens into the vestibule. 4 or 5 molar glands which is situated in the buccopharyngeal fascia also opens into the vestibule. That is, 4 or 5 molar glands which are present in the buccopharyngeal fascia, it also opens into the vestibule. Except for the teeth, the entire vestibule, it is lined by the mucous membrane. Except for the teeth, the entire vestibule, it is lined by the mucous membrane. So now we will discuss about the lips. So what is lips? Lips are fleshy fold of skin which is lined externally by the skin and internally by the mucous membrane. So lips are the fleshy fold of skin which is lined externally by the skin and also internally by the mucous membrane. So what are the layers of the lips? The lips, it has got 5 layers from outside to inside. Which all are those layers? Outside there is skin, behind there is superficial fascia, and the third layer is the muscular layer which contains the orbicularis oris muscle, and beneath that there is the submucosal layer which contains blood vessels as well as the glands, and innermost layer is the layer of the mucous membrane. So that layer is mucosa layer. So which all are the layers? Skin, superficial fascia, orbicularis oris, submucosa which contains blood vessels and also glands, and also the innermost layer is the mucous layer. And the lips, it bounds the oral fissure. That is, it bounds the opening of the mouth, and the two lips, it connects at the 2 angles. So the upper lip, it connects with the lower lip at the angle of mouth, and the inner surface of the lip, it connects to the gums by means of frenulum. So these are the 2 frenula. The superior labial frenulum and the inferior labial frenulum, it connects the lips to the gums. So now we will discuss about the lymphatic drainage of the lips. So the central part of the lower lip, it drains into the submental lymph node, and all other part of the lip, it drains into the submandibular lymph node. So the central part of the lower lip, it drains into the submental lymph node, and the other part of the lips, it drains into the submandibular lymph node. So today we discussed about the anatomy of the oral cavity. So oral cavity, it can be divided into an outer vestibule and inner oral cavity proper. The outer vestibule, it is smaller portion compared to the oral cavity proper. Then we discussed about the vestibule and also the lips. So this is the end of today's video.
This is the end of today's video. For more videos, please subscribe to my channel and press the bell icon.